Welcome everybody, the inaugural lecture, Professor Steve Thomas. I'm delighted to be here. My name is Colin Doherty. This is my second official engagement as the head of School of Medicine. I was just elected there a few weeks ago, so bear with me. This is my first introduction to an inaugural lecture. We'll be doing this in a few weeks, so I'm hoping for tips from Steve on how to do cartwheels. So I'm going to just do a short introduction and then we get going with the lecture. I'd like to welcome the Provost here who's with us and distinguished guests and a lot of family and friends, as this occasion always is. So it's a very nice evening to be here. So I'm going to start with a quote from Steve. I think the best place to influence policy actually is from an academic position. When you're in government, there's never enough time. So Steve is the Edward Kennedy Chair of Health Policy and Management, the Director of the Health Policy Engagement for that School of Medicine. He has 27 years of international experience in health systems across 4 continents. He's a global leader in research, policy input around the health system resilience and reform, advising governments and international organisations. He was born in Bradford in West Yorkshire, the eldest of 3 children. He went to St. Peter's College in Oxford, gained an economics scholarship, and more importantly, met his future wife, Debbie, who's here with us today, and she's a children's author. He has 3 daughters who are joining us today, Emily, Ruby, and Rosa, whom he adores, and they've all just entered 3rd level education. After his BA in 1989, he did a master's in development economics, took up a 2-year post in Uganda. He then worked in Bangladesh. A post came up then in the University of Cape Town, where he also completed his PhD. In 2005, we were very lucky that he moved to Ireland to take up a lectureship here at Trinity College for Health Policy and Management, where he was a director from 2015 to 2021. He also served for 10 years as co-director of the National Sphere PhD program, which has successfully trained over 75 PhD candidates. In 2016-17, he led the Trinity team providing technical support to the Oireachtas Committee for the Future of Healthcare and its production of Sláintecare, which is now government policy to achieve universal healthcare in Ireland. Steve is currently heading the Restore program, the 5-year Research Leader Award funded by the HRB. His international team is investigating how best to enhance health system resilience, achieve universal healthcare reform, and improve staff well-being in Ireland. And his team is sharing evidence-based strategies with national policymakers and key decision makers. Most recently, Steve is a visiting professor at the University of Toronto, strong links with North American and European observatories for health policy. He's also writing a handbook of health systems resilience. So much so you can read most of that in the leaflet that you've gotten. But I did a little bit of background digging and I got some more personal comments from people who've worked closely with Steve. So the first is from Sarah Burke. As a PhD supervisor, then PI, Steve was generous with his guidance while also pushing me to becoming an academic in my own right. He is driven by a desire to improve health policy, tackle inequalities in order to make the world a better place. Steve has an innate ability to read the zeitgeist, identifying important research topics before they become topical. He secured funding for health systems resilience research years before it became fashionable and for mapping the pathways to universal healthcare in advance of Sláintecare. He manages a good work-life balance, which he encourages in others. Other comments, I've always been impressed with and appreciated how generous Steve is with giving credit, including me in publications where I've done contributory work, but didn't actually write the article. Same with presentations where he lists the names of everyone on the team. As a PhD supervisor, I think he was good about showing me that he expected me to succeed and that I would do well. He never seemed to doubt that I would make it through and was good about knowing the stage that I was at, encouraging me to just be at that stage and not rush ahead and worry about anything else. I've always found him to be thoughtful and considerate colleague, doing work that really matters for our health service and making a huge contribution through his and all the centre's work on Sláintecare. Few of us have that kind of impact. As a leader, Steve pushes people outside their comfort zone, offering opportunities and guidance while placing the necessary trust in them to progress in a truly autonomous way. But most poignant of all was the news that I read that Steve is a long-time Leeds United fan. I have been.
Ah, Ray. United suffering.
If you were in tears in 1975 when Leeds were knocked out of the European Cup in Paris, you remember that night well?
Terrible.
If that's the most traumatic event you can remember in your life, you're doing well, but it was pretty traumatic. But anyway, Steve, you've got a renewed respect. So I'm going to pass over to Steve now. So I've pressed a button.
So what have you done?
There you go. The title is Valuing Healthcare Reform, Resilience in Interesting Times. Steve Thomas.
Thanks, Colin. I got away very lightly there, didn't I? Jeepers creepers. I didn't do too much digging. Lovely to be here. Thank you so much, everyone, for coming tonight. It's a real pleasure and a privilege. It's actually been 2.5 years since I became a professor, but I actually became professor on April the 1st, 2020. And it did feel a little bit like April Fool's Day when I was there. We're in the bedroom with my wobbly trestle table, piling up board games with my laptop on top of them, trying to get the internet to work and my Zoom background. So anyway, so it's lovely to be able to do this in person today. It's a real privilege and an honor. And yeah, I think we are living in very interesting times. I came to Ireland in 2005, peak Celtic tiger, and it's all gone wrong since then, really. So I have it's entirely my fault. Yeah, exactly. So I just thought, living through these interesting times, that's actually a good thing to talk about. It's a good thing that actually really connects with a lot of the research interests that I am fascinated by and that I will be devoting my career towards. So really what I want to do is to talk a little bit about my own personal journey, what's made me who I am, where I'm going, then to talk a little bit about some of my research around resilience, to talk, of course, about universalism and Sláintecare, and because that's been such a key part of my interest, my focus, and actually the interest of people here as well. And then I'm going to do a bit of love bombing and thank yous at the end, because actually that's the most important thing. Because actually I wouldn't be standing here today without the efforts of so many people. And I really do appreciate that. And yeah, it's really special. So thank you for that. Okay. So, pause whilst audience takes in embarrassing photos. Okay, so here I am in the family ensemble. I am on the far left. So I'm the one with lots of hair. So what happened is a good point, isn't it? The keen-eyed amongst you might notice the pork pie. We'll come back to the pork pie. So growing up in Yorkshire, staple diet, of course. Now my sisters, so Jenny sitting on my dad's lap, and Hills in the red dress, and my mum are all keen dancers, all keen ballet dancers. And actually Hilary now owns her own and runs her own ballet school very successfully. Jenny also teaches dance and is an artist, and my mum still teaches dance as well. So the obvious next question is, what did I ever have ballet lessons? And I did. To confess that it is true. Now, don't ask me to do an arabesque, because that would probably kill me, and I probably would take off in this lovely high-vis gown I'm wearing. But I could probably manage a plie, and it didn't last very long. And I have done the dying swan on occasion in my career. So obviously the ballet skills were there, have been important to me. In that time. My dad actually shown here, for him, university was a very big thing because he was born and brought up in a very working class setting in West Yorkshire. And he was the first person to go to college in his street. And actually he went to the LSE and he did law. And actually when he got in, he went round and shook hands with everybody in the street. It was such a big thing. It was quite unknown. So it's quite an important thing. So I think today would have been a really important day to share with him. So I haven't been able to do that, but I know my mum is watching. Hopefully, I'm hoping this all gets recorded. It says we are recording, so I'm hoping she'll see it too, and my stepfather and my sisters too. So I've already name checked you all already. So that's a good thing. And actually, I remember one day we actually went and I remember going with him and getting some pork pies from down in the local shops and walking up the hill afterwards with our Hovis loaves and our flat caps and our potatoes and all that kind of thing. No, I didn't do any of that. But actually, that's actually got legs in my family who actually assume that I am actually Little Lord Fauntleroy. But from these photos and I sort of wined and dined with pork pies from my youth, which never happened. But anyway, whatever. Family myths live on. So those are my origins. Then I think when I got older, into my teens, I had quite a lot of attitude. bit angsty, didn't really like school. I was at a grammar school, didn't really like it. And then really, I think what happened was I actually came across economics, and suddenly, wow, it changed everything I looked at. Suddenly I became a believer. Suddenly I thought, I've come home. I found a discipline which helps me to not only understand the world, but actually make it better. I suddenly had all these tools at my disposal, and I felt very empowered with that. And I was particularly taken actually with the work of the Nobel laureate Amartya Sen. And some of his work has still stayed with me, and particularly the work on famines as failures of exchange entitlement, which sounds like a really boring title. But what he actually looked at and saw was actually the problem in a famine, and he was looking at one of the big Bengal famines, was not the lack of food, it was prices, that things became unaffordable for people. And I thought that's so relevant for a lot of the research that I'm doing, so relevant for where we are today with the cost of living crisis, that the government needs to manage those prices. So that's been a key influence on my thinking. So I was really passionate and somewhat idealistic about changing the world, and I very much got into economics and into government economics, and I thought I was destined for government. I was going to change the world, and I actually did 2 stints in government. I worked in Uganda and in Bangladesh in the Ministry of Finance and the Ministry of Health. And picture up here is me at the tender age of about 23 with my master's degree. Still have some hair, it's going, but it's still there to a certain extent. Wearing my red tie, which gives, it's all about authority, I thought that would give me authority. I'm only 23, but if I wear a red tie, people will take me seriously. And I had a good time there, but actually started to think, actually, maybe government actually isn't for me. Maybe I'm not cut out for government. I remember on one occasion being shouted at by the Minister of Finance, which wasn't my best moment. And I suddenly realized, okay, maybe this isn't quite me. So you kind of learn these things as you go on, but still deeply committed to changing things and making things better. So I went on a global pilgrimage. I learned lots of things in different places, and 3 places that I lived and worked, which I'm still here in Ireland. First of all, Bangladesh, and one of my mentors, one of the most interesting and influential people for me has been the guy on the far, James Killingsworth. He's a very interesting guy, a really interesting Texan guy. He taught me something of the dark art of politics, which I tried not to learn too much because that kind of thing is a bit dangerous. But he was very good at networking, and he was very good at discussing and bringing things, bringing important concepts to powerful people. And he did that very well. And he always had a good sense of humor too. So, we did quite controversial work there. And he always said to me, if we ever get out of this alive, they'll be burning our effigies all around town. So I think that was quite an interesting thing to take on. It stayed with me a little bit. Moving to South Africa, Professor Di McIntyre. Di is a force of nature, very formidable, powerful champion of the underdog. She was on the right side of so many issues, on the right side of history in a country which has faced a lot of trouble. And she taught me a lot about good research, but also good research for a point, good research to make a difference. And so I owe Di that great legacy. And of course, our very own Charles Norman. And Charles, I blame you for everything. Thank you so much for all that you've placed into me. I really appreciate that. Actually, one of the things that Charles says he doesn't remember this, but I actually met Charles first in Bangladesh, and he'd come over to do a workshop, and we'd been looking at health economics within Bangladesh, and we've been trying to bring that way of thinking. And we were in the British Aid guest house, and we'd had a couple of drinks, okay? And Charles at one stage stands up and he looks at me and he says, "You need to do a PhD." And I thought, I'm not that kind of, that's not my kind of thing. And it was right. And look what happened. So did it again, Charles. So thank you so much for your invaluable input. And I think your ability to actually look at things differently, to not take on the received wisdom, and not to assume that everybody knows what they're talking about when so often they don't. And so I think that was very challenging. And also your ability to be able to deliver quite difficult, uncomfortable truths in a humorous way. I think that's helped me hugely. So I'd just like to pay particular homage to you for that. So thank you so much. But as anybody who knows me well will know, actually the most fundamental influencer in my life is my own faith and my relationship with my Savior, which sounds very common, but it's true. And my Christianity is incredibly important to who I am and actually to what I'm trying to do with my research, which is to make things better. And so I'm really passionate about social justice. I'm really passionate about speaking truth to power. And that's one of the things I love to do. It brings me life. So academic life is great, but academic life to change the world. That's actually where I'm really interested. That's where I come alive. So that sounds to me that sounds a bit like I'm getting notions, doesn't it? It sounds like I'm becoming a bit above myself here, a bit sort of fancy myself as a bit of a prophet, a bit of a sort of prophetic voice. So I thought what I would do, is check out, exactly how weird and prophetic am I? Okay, so I sort of did this prophetic checker. What kind of, am I sort of a John the Baptist type? So weird clothing. So do I have weird clothing? Well, it's a good start, isn't it? Yes. I did, yes, quite. Thank you, audience participation. So 1 point for that. Wild places. Do I live in wild places? Well, I have lived all over the shop and now I live in Selbridge. So, I mean, obviously, that's where things are going, isn't it, really? Thirdly, strange food. Well, I've had words with the caterers, actually. We're going to have locusts later. So I thought you'd enjoy that. Now, we may not be, but I actually have eaten deep fried locusts in Uganda. And as a culinary experiment once, I remember actually trying to make leek and locust lasagna. And say it wasn't so much the taste as the crunch. It was a little bit too crunchy. So anyway, strange food, definitely double click. Okay, so we get 2 points for that. Questionable hygiene, I think that's too much information. And then finally, head on a platter. Not yet. We have some way to go. Story isn't over yet. And of course, the art, I guess, of taking the sort of prophetic academic is that you go just far enough and not too far. So we'll see where that one goes. And I'll come back to that point later. So we've got well on the way, I would say. Okay, going to do let me talk about research now. Particularly resilience in interesting times. I arrived in Ireland at the peak of the Celtic Tiger. And then since then, we have had massively interesting times. And our times seem to be getting even more interesting as we go along, as we go from one crisis to the next. And so that presents a fundamental problem for how you manage your health system through these particular things. And the point was made to me very clearly by some work that I was involved with the European Health System Policy Assessment Working Group in 2020. And this was before COVID, and they did a survey of EU health system experts. And they asked them 6 months before COVID, what are you worried about? What are the key shocks that we need to protect our health systems from? And here is the list: epidemiological shocks, environmental shocks, technological shocks, societal shocks, geopolitical shocks, you name it, it's out there. We're living in a kind of frightening world. How do you manage our health system against all this vast array of different shocks? And that's the shocks that we know about. For the Sharknado is quite a good film. So I don't know, I've never done it, but you can check it out. So what I did was to sort of start to investigate this off the back of economic austerity, and came up with these concepts of absorptive, adaptive and transformative resilience, drawing on some of the socio-ecological literature. And that was really a game changer in how people started to think about health system resilience not just in Ireland, but across the world. And thinking about how do you protect from the massive resource imbalance that comes from a shock. It either sucks out lots of your ability to be able to respond to problems, or it massively increases all the problems. So either way, there's a huge imbalance going on there. So came up with these ideas of absorption, adaptation, and transformation. So can you protect against that resource imbalance? If you can't protect against it, do you make the system more efficient and agile? And if you can't do that easily, you have to then move into restructuring. And I thought that looked pretty good. And it came to me that it was almost like a series of dominoes. You start at absorption. If that falls over, you try and get adaptation. If that goes over, you go for transformation. And we came up with some interesting measures, myself and some of the team here, some of the original resilience team. It's good to still have you here. And we came up with some interesting measures. How do you do that? How do you protect households? How do you make the system more efficient? How do you look at transformation? And that all seemed very good and influential, and we made a difference, and it helped the Department of Health, who will be forever in my debt, because I got you another 600 million from finance. So there you go. So you owe me one, right, for that one. And then I thought, oh, great, that's good. That's excellent. We've done that. The crisis is over. The shock's gone away. Job done. No problem. And then it wasn't. Because actually what I then started to do was looking at the health system performance, see legacy issues that were coming out that actually were coming out only after the shock had gone. So in other words, we'd been changed in the process. Our system, our society had been changed, and we were having to live with the legacy well after the shock had come and gone. So if you see here, what we have is the inpatient waiting lists flying up long after the economic shock has gone, which sort of ended around 2013. And even with more money coming, and suddenly was there this release of pent-up demand, which looks very similar to where we are now, sort of backlog of care issues. So I realized that actually, it's not just about what's happening in the shock. So my previous framework wasn't sufficient to it. And I think this came home to me, particularly when I went on the road again. I sometimes do some of my best thinking on the road, and I went to Portugal. And I went for a conference. It was very interesting when we were talking about economic crisis and all this and the other. And then I spent a couple of hours in the Central Square in Lisbon, which is a lovely place, very beautiful, very well designed, fantastic. And I went into this museum here, the Lisbon Story Center. And I went through it, and it was all very nice, talking about Romans, blah, 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 blah. And it got to this audio-visual theatre, a bit like sort of similar size, but it was all done remotely. So the doors opened remotely. And I was the only person in it. So I was the only person in the auditorium. So they waited to a certain time, and then they opened like this. And I walked in, and I sat down. So perhaps where Porig is now, just me in the entire auditorium. And there was scenes of 18th century Portugal, and people were sort of walking around and having a nice time. And I was thinking, oh, this is all very nice. It's an interesting, immersive thing. And then suddenly there was a massive earthquake and this huge sound system. And the masonry was falling, and people were falling over, and there was a huge fire. And it was devastation, and then a tsunami and water and everything. It was horrendous. This audiovisual was terrible. And just huge devastation caused. And this, of course, was the great earthquake of great tsunami of 1755. It devastated, it smashed Lisbon. And I was in shock watching this because I wasn't expecting this at all. And then a door opened in the far side of the auditorium by itself. The light went on. Okay, better go through that. So I went through there and walked through it, more scenes of devastation. But then I came to a table, a bit like this. And there were some various people standing around it. And they had blueprints and they had plans all over the place. And they were looking and they were pointing. And I suddenly thought, aha, of course. They rebuilt the modern city of Portugal off the back of that. And that's what we can do with health systems. When shocks come, we can rebuild them. We can rebuild the health system to make it better. And that's one of the key things that I think we're looking at now with COVID is to launch it and leverage Sláintecare through that process, because actually what shocks do is they clear things away and allow you to start again. And now the modern city of Lisbon is beautiful and fantastic and has lasted for hundreds of years. So can we think about shocks in that way? So round two of thinking around health system resilience was to see actually shocks as a dynamic cycle that are going on, not just those three dominoes, if you like, but this dynamic cycle of preparedness, shock onset and alert, shock impact and management, and recovery and learning. And this is some work that has been very influential and taken forward with the European Observatory, and gives us an insight about how we need to think about shocks, whether it's COVID, whether it's cost of living crisis, whether it's economic austerity, what it is, gives us the equipment to try and take and move the health system through these things to survive through it and somehow to improve it as well. So, and I think there's much more to be done. What I'm going to be doing particularly is thinking about a lot of these issues in the next few years with my research team, and think about how do you get properly prepared so you're not misprepared. I think that's one of the problems, isn't it? You take a knife to a gunfight sometimes, and that's how we deal with shocks. Even when shocks come, you're fighting the previous war. So thinking a little bit what are different kinds of shocks, how do they impact the system, what can we do to be prepared for anything, and understanding how each shock actually facilitates other shocks. So actually, COVID has facilitated the cost of living crisis. You can see the dynamic macroeconomic effects going on there. And actually, you can see this linkage going on. So if you can understand those linkages, then you can start to see where each shock is leading us, which I think is an important thing to do in terms of getting our health systems prepared. Okay, so that's my kind of resilience speech. And that's where I'm going with that. So I'm very excited about that. Yeah, dealing with some very interesting issues. At the same time, and I touched on a little bit that in what I was saying before, I think also it's massively important that we value our healthcare reform, particularly our healthcare reform in Ireland, which had its 5th birthday in May 2022. And you'd think we'd be well on the way, we'd be halfway there, because it's halfway through the 10-year plan. And let's come to that now. So it's an important issue. So just in case you don't know, for people who aren't technical, what is Sláintecare all about? It's all about having an entitlement to care. It's all about getting entitlement to care for everyone who's resident in Ireland. It's a good package of care, waiting times down quite strongly within good week limits, eliminate or reduce charges, a lot of care free, some care vastly reduced in price, integrated care, providing care at the lowest level of complexity, through massive funding, through tax system with the transition fund, private care out of public hospitals, and of course the office to drive reform. So that's the sort of Sláintecare package in brief that we all kind of signed up to and is now government policy. But Sláintecare's passage has been quite tricky. And if you look at the plans versus realities, how has it actually worked? And this is a key thing that we all need to be very bothered about. And in the first 2 years, very little was done. Removal of inpatient fees was actually set for year 1. Did it happen? No, it didn't. 400,000 more with free GP care. Did it happen? 5,000 more with free GP care. Reinstatement of dental benefits for people with only cards? Nope. Reduction of prescription item charge to 0.5 per item. Instead, lowered by 0.5 euros per item. And in actual fact, so we seem to have done such a good work with Sláintecare, and yet for some reason, it just wasn't getting traction in the system. And we actually had to play Where's Wally? Okay, you know, remember Where's Wally? We actually had to look through government documents to find, did they actually use the word entitlement, which had been such a critical part of the Sláintecare policy. And we found it in one place. But Where's Wally? It was there. We found it, but it was only used once in one document in 3 years. So that really spoke a lot about, well, we're saying Sláintecare, but what's actually going on here? And this is the phenomenon that I call guards. Okay, and guards is actually from a Terry Pratchett novel. and talks about the predicament of being a guard. And if you are a guard, you are called to act in difficult times. And the problem with that is that if you rush toward the problem, you're going to have to deal with it. But if you don't do anything, people start shouting at you. So the best thing you can do is rush slowly towards the problem and then into trouble. And then by the time you get there, hopefully the problem's gone away. And really the first 2 years of Sláintecare was the government rushing very slowly towards the problem and not really, I think, taking it on. And so we talked a good game, but actually we weren't quite getting there. And then COVID came. And suddenly COVID gave us rockets. It could also have been the prospect of a resurgent Sinn Féin as well, putting banners on government. Suddenly, with COVID, we realized actually we need that good health system. We need it to work. We need it to work pretty quickly because we really could have done with it being in place. And 20% more money coming in 2020, all for, if you have COVID care, we're going to make sure that you don't have to pay for it. So a taste of universalism. We're starting to taste what there is there. And masses of money, not just for COVID, but actually for the capacity elements of the Sláintecare reform program. So suddenly government got it. We need to start shifting. We need to start moving. And probably because we had a surprisingly robust economy and the health service was obviously seen to be popular. And there seemed to be a money, no object attitude. Now, of course, there are dangers in that. The dangers in how well that is utilized, is there a proper accountability for it? But it certainly marked a remarkable sea change from what had gone before. And that seemed to be great until it wasn't. And suddenly we thought we were getting somewhere, but actually behind the scenes, there were signs that things weren't going right at all. And we had Laura McGahey, who resigned. We had Tom Keane, who resigned. Key head of people in charge of Sláintecare, because basically what they were saying is a lot of the key issues that government had signed up to, they weren't actually getting to get them across the line. They weren't actually able to take them forward. And then that happened, and then we went through, a season where we didn't actually know what was going on. But seemed to be reorganisation with the department. Who's actually in charge of Sláintecare? Where's it going? What's going on? So Sláintecare had a very sort of checkered history, and I like to see it in 4 ages. The 4 ages of Sláintecare: spring chicken, rubber chicken, steroid chicken, and headless chicken. And I think that's really where we've kind of been. So spring chicken, yes, we're going to do this thing. We're actually going to bring universal healthcare to Ireland. We're going to catch up with so many other universal health systems. Rubber chicken, we're talking, it's pretending to be a chicken, but it really isn't. It's not really Sláintecare. It's not really happening. And then suddenly we're on steroids and we're pumping everything into it because we have to, because it's a pandemic. And then, we've lost our way and we don't know what's going on. And given that track record, I was certainly very worried about what's going to happen next. And as you know, as my colleagues know, I sometimes use this picture. This is me age 70. I've got one of those apps where you age yourself. And it's options. You can have age yourself with a lot of cigarettes, or age yourself with a lot of wine. And this is the wine version because I don't smoke. So this is me aged, and I'm terribly worried that I'm going to get to emeritus, and actually we really won't have got there. So one of my key focuses is that we really need to do this. And one of the interesting things that talking to some colleagues, some international colleagues, and they say the big challenge for health systems post-COVID is, do they get to stay at the ball with the prince? Do the Cinderella healthcare services get to be fated and whined and died and twirled around the ballroom again with lots more money and favor? Or do they have to go back to the kitchen? And do they get rejected again because we've moved on? And that's the key challenge for the health systems at this time. Do they get to retain their favor? Now, actually, to be fair, Budget 2023 says there may be a couple more twirls around the ballroom yet for Cinderella. There does seem to be a push towards universalization, GP care, free GP care, removal of hospital inpatient fees. Now, that was actually for year one of Sláintecare, but okay, better late than never. We're getting there. You can hope. So hopefully, me getting to emeritus, I won't win the race in terms of Sláintecare and me. So we'll see what's going to happen there. I think Sláintecare is very interesting, and its relationship with shocks is very interesting, because in many ways, Sláintecare was born out of austerity. The crisis was that bad that we really can't have a health system that isn't functional. And I think that brought a lot of political cohesion together, and a lot of leadership, of course, from Rasheen in the room to bring Sláintecare to the table. Strangely enough, it was reinvigorated by COVID, and suddenly people seemed to get the message that this is so important. And actually, it is required. It's required. A well-functioning health system is resilient to shocks. And this is a cost of living crisis. People are going to struggle to pay for their healthcare services. We need to have it in place. So I think interesting dynamic between shocks and universalism, and thus the title of my talk being Valuing Healthcare Reform, Resilience in Interesting Times. Now, this is kind of a contested space, as many of my colleagues know. And, you do this work, and it's great to do, but sometimes you get a lot of fan mail. Like that one. Nice. And my personal favorite, why don't TCDW and economists do something useful and not harmful, rather than spend their time cooking the primary care books to curry political favor? Because they were into fake news long before the Donald. I think we should have t-shirts. The Centre for Health Policy Management t-shirts. We don't give a toss. No. But I think it's interesting because we're in a very contested space. And I think we have to protect and we have to cherish. And it's great that obviously this is personally great for me. And it's a privilege and a joy for me today to be able to give this inaugural lecture, to talk about this and to share this all with you. But there are many colleagues here who aren't going to get that privilege. And I'm so keen to protect them. And sometimes we don't. We don't protect them from outside forces or inside forces. And we have had, we haven't done as well as we could do to preserve and protect the careers and honour the people who've worked hard to deliver these huge changes to the Irish healthcare system, which will save so many lives. And I think it's incredibly important that we protect this capacity within Trinity, and we champion it, and we champion the people who do it, who've given of their all in such a good way to make such a big influence. And we can discuss that further, what we can do about that, because that's so important. I now get to the bit which is fun, but I've had to write things down as I'll forget. So I just want to say thank you to so many people for all that they have done, so many institutions. I want to say thank you so much to the HRB, who I invited. I'm not sure whether anyone's here. Are they? Oh, yeah. Charles, double duty. Yeah, that's true. Thank you for all the money. It's been great. Thank you so much for funding so many interesting projects and interesting initiatives. It took you 5 years to give me any money, but I'm not going to hold that against you. Not for too long, anyway. And thank you so much for funding the Restore program, which has been brilliant, and has given us a lot of time and space to really develop an advanced thinking around health system resilience. I want to say thank you too to the faculty for organising the event, for Lena, for all your tireless work. Lena, thank you so much. For Kevin, helping me with all the technicals for the catering. It's going to be brilliant. And Colin, for actually not digging up as much dirt as I thought he was going to. So thank you for that. I want to thank the School of Medicine for their support. Obviously, it's going to be a pleasure to work with Colin. Thank you so much. That's going to be great. Thank you to Michael Gill, who always had my back. I don't think Michael is here, unfortunately, but he was great. And thank you for the management team. We meet on Monday morning, and they always brightened up my Monday morning on Zoom in the pandemic. It was always a lovely ritual to have that with my morning cup of coffee. I want to thank everyone in the discipline of public health and primary care. I'm excited about this discipline now. That has changed a lot because I didn't used to be. So well done, the leaders who've done that. Well done, Noel. Well done, Catherine Darker. Well done, Susan. Well done, Catherine Hayes, Lena, everyone. It's an exciting time to be part of this, and I think we're getting some real initiative and momentum, and so that's excellent. Yeah, and then just obviously, thank you so much to my colleagues and friends in the Centre for Health Policy and Management. You've been an amazing team. You are an amazing team, and I value each of you and what you've done, what you contribute. I imagine I really. Yeah, I'm kind of a bit lost for words, really, because it's been such a wonderful shared adventure for so long. And I thank you for all that you've contributed. It's very stimulating. It's exciting. We're changing things. We're changing things in Ireland. We're changing things internationally. I think it's a great time to work, on a lot of these things. And yeah, thank you. Thank you particularly to the Sláintecare technical team. Those were heady days. And we still have to keep focused. Thank you to Sarah Barry. Thank you to Sarah Burt. Thank you to Reka Searsbeck. Thank you to Bridget Johnson. That's great, but the job's not yet done, and we still have to keep pushing. It's a contested space, and we still have to keep bringing the excellence of our research into the marketplace. And the interesting thing is, in policy, you cannot afford to have substandard research, because substandard research will be jumped all over. So it has to be the highest quality and then targeted to the greatest good. So well done for our continued excellent research. I pray that there will be more exciting things that are going to come through, some things in the offing. Thank you. I mean, there's some great projects in the centre. The Foundations project led by Sarah Burke's amazing. And of course, lastly, to my own Restore team. Thank you so much, guys. You're fantastic. I couldn't get, I've got some pictures up here. I haven't been able to we haven't had any group pictures for a while. We need to update some of these. But thank you so much for the international team. But in particular, thank you to Ori, Catherine, and Ariana sitting there on the fourth row. And you've been great. It's really good. It's really exciting. It's innovative research. We're making a big difference. And what we're seeing now is a lot of that research starting to come through, particularly with the Presto report, but also internationally too. And I would say the best is yet to come for us. So thank you, guys. My family. Thank you to my precious, beautiful daughters. In my head, we're kind of here, but I realize you've grown up. So apologies if my parenting style has not changed. But it's so wonderful to see you flourishing and prospering, particularly after these tricky COVID years when it was not a good time to be in undergraduate education. And it's so exciting now to see you forging your own paths, which is brilliant. So thanks for all your support. And of course, last but not least, thank you so much to my beautiful wife, Debbie, Debs, the love of my life, my partner in crime, and my much, much better half. Thank you for this, for all your support, and it'll be my privilege to give you, to reciprocate as best I can. So thank you for that. And thank you everyone for coming tonight. I hope it's been good. I hope I provoked you a little bit, but hopefully not too much. I'm hoping that the Department of Health people will speak to me again. So hopefully that will work. And I think we probably need to see if we can be resilient towards the catering now. I'm sure it'll be fantastic. So thank you very much.
I don't know is there anybody who wants to ask? This is forever hold your peace. You're not going to answer a question.
No, okay, if you must. Yeah,
Is there an embarrassing story even from a family member? No. A Leeds United story? No, that would be too sad. Well, I'll bring the formal part of this lecture to a close and invite everyone up to the back for some light refreshments.